Hi, Paul Silovsky here, physical therapist and owner of Rebound Physical Therapy. And today I want to talk to you about loss of balance and some of the causes and remedies for that. Now, I want to distinguish here that I'm going to focus mainly on balance loss as opposed to just dizziness or vertigo. You hear that term too. But I want to lock into why that's so important to address early in life. Mainly because it can be very distressing for someone as you age to worry about the risk of falling. Obviously, the injuries that occur after the fall, it isn't so much the fall, it's the landing, right? That gets you if you fracture something or create further harm or injury. So if you can get in front of it on a prevention mode or from a prevention standpoint, it's super helpful because there's several systems that are involved in keeping you upright, keeping your center of gravity, which is in and around your belly button, inside of your base of support, right? So how wide or narrow is your base of support, and can you keep your center of balance inside of your base, right? That's one definition of balance or loss of balance when your center of gravity goes outside of your base of support. You lose your balance. You're at risk of falling and landing on the ground, creating further harm or injury. And it also has a mental effect from the viewpoint of fear of loss of balance, keeping you from doing things. So look, there's many systems involved with keeping you upright and maintaining your balance. Of course, we've got the muscles and the joints and the integrity of them. More on that in a second. But you have to maintain a certain amount of strength. Your joints have to be in good shape. You have, for sure, the nervous system that's giving you feedback from your environment, from the ground, your position in space. You have your eyes and your ears, your middle ear, very important on the vestibular system, the one that can make you dizzy or feel unsteady. Get the world spinning around you. They're all working together. I mentioned the nervous system. There's many things that can affect your nervous system. Injuries, illness, surgeries, medications. All these things can affect your ability to stay upright and feel and operate in a balanced fashion. Now, we also have surgeries, like I said before, a multitude of illnesses that can create balance challenges. So there's a lot going on here, a lot of systems to address. I can give you one simple example. We see a lot of orthopedic conditions, and believe it or not, orthopedic conditions like an ankle injury or a knee injury or surgery can affect one's balance tremendously, because if, let's say, someone sprains some ligaments in their ankle or tears their anterior cruciate ligament, the ligament in the center of the knee, one of the crisscross ligaments that has a rotational element, gives great stability to the knee. Even if you have that reconstructed and replaced, or an ankle that heals, you damage the body's ability to correct its position in space or have an awareness of how to stay balanced. I've had a couple knee surgeries on my left side, right? And I've had to work very hard, to compare right to left in my ability to maintain my balance. You have to train it to recover it, because you don't just injure the soft tissue structures of the joints, you injure the ability of the body to correct itself. It's called righting reactions. Can you catch yourself when you start to fall and right yourself, bring your center of gravity back inside of your center of balance and stay upright, right? So we train these things through multiple systems. Heck, I didn't even mention the circulatory system. When your blood pressure drops, you can get dizzy and lose balance. So we're affecting the neuromusculoskeletal system as physical therapists, treating you so that you can stay upright and keep moving. Because as long as we keep moving, we live in a motion-based universe. If you can stay up and keep moving, you're gonna do pretty well. You have the ability to maintain your strength, your posture, your balance, your flexibility. You have to work on all of those things in order to function in everyday life. So listen, physical therapists can help you not only keep what you've got, but recover from balance loss issues once you do have an episode. If you start to lose your balance, start to feel unsteady, or you have an injury or surgery and you feel a little bit off and a little unsteady, come see a PT. We can help you recover the ability to balance through your strength, your muscular systems, your joints, your neurologic system. We certainly, with exercise, affect the cardiovascular system too, but it's a collective approach to keep you upright, keep you moving, and doing the things you love. So we love to get you back in action. Give us a call. Love to give you help.